Friends, Dr. Neil Nedley has been educating people with depression, anxiety, and a host of other mental disorders for 15 years. His data shows that he has helped scores of people with those disorders. Dr. Nedley, can you talk to us a little bit about and walk us through what the Depression and Anxiety Recovery Program is all about?
Well, first, it is highlighted that depression and anxiety have multiple causes. And until those multiple causes are found and reversed, we can't actually cure the patient.
Okay, you used two words there, Dr. Nedley, recover and cure. Are you saying that depression, anxiety can be cured?
Absolutely, it can be. And it actually can be done far more simply and more easily than what had previously been thought of. It's what the research is showing.
Okay, so the research is showing that a person must learn though first. Does your program help with that?
Well, that's one of the mysteries in depression and anxiety. There's no obvious cause according to the psychiatric Bible. It tells us to rule out thyroid problems, but often the patient has no clue what's causing it, or what they're thinking is causing it is not really the cause. And even the doctor often doesn't have all of the causes in that patient known to them. And so, one of the most valuable things about our 8-week program is the first week they take a test. Okay. This test has actually been validated. It will not only show them whether they have depression, how severe it is, it'll tell them whether they have anxiety, it'll tell them their emotional intelligence scores, but the most valuable thing about this test is that it will tell them what the underlying causes are in them. It's a screening test for the 10 different categories of causes. And it turns out for a depressed or anxious person, normally they have 4 hits or blows to the brain or more. And all of them, except for 2, can be reversed. So once we know that, that is a foundational piece to actually bringing about not only a reversal, but actually a cure.
Now, Dr. Nedley, that sounds like a test that everyone should take. Now, I assume that when you compare the value of this test, it almost might be compared to being as valuable as gold. And so, once a person knows what's causing their depression and anxiety, are they now in a position to find recovery or healing from that depression?
Once they know the causes, they can start working on their particular causes that are active in them. They can reverse those causes, and the results of those lifestyle changes, often it requires some simple lifestyle changes, but the effort involved in those simple lifestyle changes is well worth the effort.
Okay, so Dr. Nedley, what is it like to go through the program?
Well, it's not only interesting and educational and thought-provoking, but it's often described as enjoyable and fun. The first hour of the program is when they receive the education from a video. Actually, I'm the one sharing the video from the scientific perspective on how the brain works and how we can take advantage of that and how we deal with all of the 10 hits and the aspect of the program. But then the second hour is the applied part. And that's when they sit down in a group setting, and there's a facilitator that's been trained by us that actually helps them to help themselves, so to speak, on how they can apply the information that they just learned and incorporate it in their daily life.
Now, you know, there's the old adage, you know, we need to get to the place where the rubber meets the road, so to speak. Are you seeing results? Are people actually being helped by this recovery program?
Well, the American Journal of Lifestyle Medicine just published the results on our first 4,200 plus people who've gone through the program from multiple countries. That's a large number of people that have been studied, because most of the The medication studies are done on hundreds before it's released to the market. So this is a large database of people who've actually been educated by us, going through an entire educational program, 4,000 plus 4,200. So looking at the results, which you should see on your screen right now, on entry into the program, the average of all the participants was moderate major depression and mild but close to moderate anxiety. At the end of the program, the average participant left with no depression and no anxiety.
Now, Dr. Nedley, that is amazing. In fact, that's nothing short of wonderful.
Well, I call it a God thing, and I say praise God from whom all blessings flow.
That's right. Praise God from whom all blessings flow. You know, it is a privilege, Dr. Nedley, that God has entrusted you with this information to share with communities, because He wants to see people healed. He wants to see people recover from anxiety and depression and other mental disorders.
It is quite a privilege, but it's also quite a responsibility as well.
Now, Dr. Nedley, did your data break any of this information down? You know, for instance, although the average participant entered the program with moderate to major depression, what about those who entered the program with severe forms of depression? Do you have any data on that?
Yeah, we actually do. Let's look at those who came into the program with severe major depression. 95% of them experienced at least some improvement after 8 weeks.
Dr. Nedley, that is simply amazing. Now, do you have any measure of how much improvement these patients were seeing?
Yes, we actually did, because of the pre and post test actually tells us how severe or mild the depression is. And we have it broke down. There were 983 people who entered the program with severe major depression. 42% of them, in blue, improved a whole category to moderate depression. As you can see, 21% of them in red improved to mild depression. And even more than that, 23% of them in green improved to absolutely no depression whatsoever by the end of the program.
Now, Dr. Nedley, this all occurred in 8 weeks?
In 8 weeks. Actually, the test was 7 weeks apart. So the program is 8 weeks, but from the pre and post, it was a 7-week interval.
In a 7-week interval, dramatic change. That is wonderful. Now, drug companies, when they talk about results, they look for something called response rates. Have you looked at response rates for the people going through your program?
Drug companies used to call a response rate any improvement whatsoever.
Okay.
But now they've been challenged to a higher standard than that. And the higher standard is, to call it a response rate, they need to have at least a 50% reduction in their scores for depression and anxiety. So we looked at that in our database. And as you can see, 85% of those who entered the program with depression had at least a 50% improvement in scores. That is actually a higher response than any other treatment or even any medication.
That is phenomenal. Now, Dr. Nedley, what about anxiety? What kind of response rates are you seeing when it comes to the issue of anxiety?
Well, those results were actually quite surprising to us, Chris, because anxiety is actually thought to be much more difficult to treat than depression.
Wow.
It requires normally 2-3 times the doses of antidepressants before we start making a benefit as far as anxiety is concerned. And our program originally was designed more with the depression treatment element than the anxiety treatment element. So when we looked at the data, those who came into the program who were suffering from anxiety, 87% of them experienced greater than a 50% improvement in their scores. So that's a response rate of 87%, again, much higher than any other treatment that has been described.
Now, Dr. Nedley, again, this is amazing information. Now, did you break out those with severe anxiety from those with moderate anxiety?
We did. We broke it down, and as you can see, 93% of them experienced improvement. 26% improved one category. The group in red on your screen, 36% improved to mild anxiety. In the group in green, 24% ended the program with no anxiety whatsoever.
Now, let me ask you a question. Do you know why some improved more so than others?
Well, that's a good question. And what our data is showing is it simply has to do with how much of the program they implemented. See, this is a mental health education program. No one is forcing them to take a pill, for instance, or to do anything. They're just coming to the program and being educated and being coached and encouraged to change their lifestyle. And some were willing and able to do that more so than others. And so the ones who were able to reverse more of their hits did better than those who were not able to reverse as many of their hits.
Dr. Nedley, again, this is just not just interesting, this is really amazing information. And I know that you've published other data about your 8-week program. What else have you published about the 8-week program?
Well, there was an interesting data set that we looked at. The American Academy of Addiction Psychiatry actually requested papers on this subject. And so we looked at those who were taking benzodiazepine medicines entering the program. It could be sleeping pills, it could be anti-anxiety things like Xanax, lorazepam, Klonopin, these types of medicines. And then we just looked at how much they were taking at the end of the program. And we were amazed to find a significant drop in benzodiazepine usage. And why this surprised us is because benzos are addictive. They're hard to get off of. But what we were finding out is when people actually incorporated the education on how to improve their brain, they were able to successfully get off of those. I'm sure many of them had help of a physician to help them wean them down. That would be the best way. That's what we'd recommend for patients. Once they get better, go to their physician on how to get off of these medicines. We, of course, in the education program, tell them not to stop medicine without their doctor's permission. But we were surprised at the large improvement in being able to get off of the benzos. And as a result, the national news picked it up. There's an organization called Medscape, and they mentioned how this novel depression recovery program is one of the few things, if any, out there to help people get off of their benzodiazepines, and it went nationally.
This is exciting. Published information demonstrating that this is not some fly-by-night program. This is a program that's actually helping people. Anything else that's been published about the 8-week program?
Yes, the hepatitis C study. We actually have a question mark in regards to hepatitis C, which can bring about depression and also cirrhosis of the liver. And so we took a look at the number of people that had hepatitis C when they entered the program. And we found out that they improved in that program just as well as everybody else. Now, why is that good news? Because they can't undergo treatment if they have depression, because the treatment can actually make them suicidal if they have significant depression. So if they come through our program first and their depression goes away, then they can get the treatment for hepatitis C to get rid of the virus and prevent the cirrhosis of the liver. So that's going to be presented at the DDW conference, the largest GI conference in Washington, D.C. in May of 2015. Some of you watching this today, it might be after that time period, but after that point, it's going to be printed in the journal Gastroenterology, a prestigious peer-reviewed medical journal.
Time and time again, we're seeing that this 8-week program is helping people in phenomenal ways. What does the 8-week program consist of, Dr. Nedley?
Well, it's 2 hours a week for 8 weeks. That's the commitment, and it's really not a lot of commitment for those type of results.
2 hours a week for 8 weeks, and we're seeing this kind of dramatic results. Now, there may be someone who needs more than just the 8-week program. Dr. Nedley, do you have any other programs besides the 8-week community-based educational program?
Well, we run a therapeutic program ourselves, which is a 10-day intensive mental health boot camp. And these are for people that have severe depression, severe anxiety, and may not have been able to incorporate these changes in their life. We talked about those who didn't improve as much as others. The good news about them is many of those individuals who didn't improve were referred to our program. And during our program, they did improve. And so the 8-week program helped to educate them, and then the 10-day program helped them to apply that information in their life so that they could experience the significant benefit.
Okay, now you've spoken generally about who fits into the 10-week program, but maybe more specifically, can you speak of who might be a good candidate to come to the 10-day in-residence program?
Yeah, those who've had severe trauma in their life. There are many individuals that have been abused in their childhood years and are experiencing significant emotional issues still related to that. Those who've just simply not been able to get out of their depression and anxiety and seem to be stuck. Also, post-traumatic stress disorder, obsessive compulsive disorder, panic disorder, those with self-mutilation and who have been cutting, those who are near suicides or have attempted suicide and are still having issues with that. Those would be prime candidates for our program. And those are individuals that actually need some help in implementing the nutrition and lifestyle changes that are necessary to improve their condition. Also, those who need to have no stone unturned. We do extensive lab work. We do a very comprehensive evaluation, and we also have great clinical psychologists as well as other counselors. And so those that need the individual counseling, the individual physician input, and we don't spare any resources in helping everyone that comes to that 10-day program to an experience of marked improvement in their emotional and mental health.
Now, Dr. Nedley, you have talked about the research that's been done on the 8-week community-based program. Any research been done on your in-residence, your 10-day program?
There has been research published. The first research we published on that were those with diabetes that had higher hemoglobin A1C levels. Since we do blood work on everyone, we can now do data on those that have abnormal blood work. And the question was raised, is there any relationship to nutrition in their hemoglobin A1C levels? Because they also answer a nutrition inventory. And we did find, yes, their diet was directly related to how high their hemoglobin A1C was. But in addition to that, we found out that they did just as well in the program as people who were not diabetics. And there's a condition called diapression, because diabetes and depression tend to go hand in hand, and it's thought to be more difficult to treat. But we found in our 10-day program that they did just as well. And of course, we're also attacking the metabolic issues of their diabetes with nutrition as well as part of that 10-day program, and that's probably why they've improved so dramatically. Their BDIs, Beck Depression Inventory, went from 24 moderate to severe depression down to 6. No depression at all in just 10 days.
That is, again, truly amazing information. And now, Dr. Nedley, people are watching this video right now, and we've presented two options to find help with depression and anxiety. The 8-week community-based educational program, or the 10-day in-residence program. Two options for people that are experiencing depression and anxiety.
Yes, and they can, as mentioned, they can even do both and get extra benefit.
Dr. Nedley, this is so exciting. In fact, nothing short of wonderful.
To God be the glory, is what I say, Chris.
I want to encourage two groups of people. Those who have been struggling with mental disorder, or those who know someone who's struggling with mental disorder, to make a commitment right now, to make a commitment to go to the 8-week community-based educational depression recovery program, or to go to the 10-day in-residence program and get help and find a way out of depression.
Proven results, priceless benefits, health of body, mind, and soul will be the result.
you.